Hello everybody, Hassan here from Galaxy Invest. So today I want to do something different. I want to go and dive deep into an interview that happened a little bit under 2 weeks ago between the CEO of CRISPR Therapeutics and I guess this individual called Tony Butler in a conference call. And this was for I guess a conference and it's posted by Seeking Alpha, which obviously um, is a legitimate website that posted the transcript. I could not find the actual interview on YouTube. If anyone has the video link, please let me know. But I was actually pretty stunned that this interview, no one talked about it. Like, I think I found it like from some random tweet that had like 1 or 2 likes. But I couldn't find anyone that covered this interview. I just found it really crazy. Like the CEO of one of the most, in my opinion, revolutionary companies of this decade is just going way under the radar. I think these are like bullish signs, but this is just my opinion, and that's what I wanted to do today. I just wanted to go and dive into this interview. Um, and just a side note, I really appreciate the feedback that I'm getting from some of these videos. I really appreciate it, guys. So don't forget to like and subscribe. It really does help me, and that's my goal, right? Just to promote information about this company and just the space in general, right? In gene editing. Okay, so let's dive into this interview here. So now there's these introductory comments here, and obviously we won't go over those. But I guess Tony Butler, he's asking the CEO, what are the takeaways for the CRISPR company? What should investors be aware? And then Dr. Sam answers, it's a premier gene editing company with over 400 employees, going from small to this today. So nothing new here. He's giving credits to the two Nobel Prize winners a few months ago. Obviously, these two individuals discovered the Cas9 in 2012, I believe. So that's fine. He's basically reiterating that 10 of 10 patients were effectively cured after the treatment for sickle cell and beta thalassemia. So I covered that in a previous video, so nothing really new here. The only thing I wanted to mention is that just the fact that he's reiterating those updates, he's reiterating that clinical trial, he's just reiterating that hey, things are going really well. And we'll see just shortly here why I'm mentioning that it's important to understand why is the CEO reiterating the positive results, right? Obviously, he cannot predict the future, but he can be bullish about it because he's gotten positive signs that perhaps some of us have not. Obviously he's an insider, right? So he must know more than we do. So I think those are just, again, it's just speculation, but I think we should get those signs from these types of interviews. At least that's what I try to do when I look for any positive signs or negatives, right? So here he's talking about the CTX 110 program. That's nothing new here. Okay, that's fine. I think we're very encouraged by what we saw in the first data released in CTX 1110. So again, he's just reiterating some information he gave in the conference call as well, I believe. So nothing new here. So he's talking about his all three CAR Ts. So these are the future end of this year. He's filing for IND. That's fine. That's nothing new. So what's really interesting about this is that he basically ends the first question that's asked by the interviewer. He's basically saying, if you look at what I'm just highlighting here, he says, ultimately a set of portfolio choices which allows us to scale this company to a 20 billion to 25 billion company in the near term should we get positive data. So this is really interesting, right? This company right now, if we can Google this, but right now I believe it's worth around $8 billion market cap, maybe a little bit less. He's basically saying that in the near term, whatever that means, right? In the near term, this company is gonna be worth maybe 20 billion, maybe 25 billion, should we get positive data? And I think just from what he just mentioned here, if we go back here, and he's saying basically 10 on 10 patients were cured, and data, and basically he's saying that was a major data update, and things are looking positive. And should they keep on getting positive data, this company is gonna basically triple, right? At least triple, which is really interesting, right? In the near term, I don't think you get many CEOs that talk in this sense, right? This is very, again, I'm sure he's just answering the question, and the question was, what should investors know about this company? He's just basically giving his honest opinion, and he's not really releasing anything here that we didn't know. But the fact that he's basically saying this company could potentially triple, and I think at the time of this interview, I think it was worth around 8 or 9 billion as well. So this is really interesting. And then if we keep going here, okay, the analyst starts asking question. Okay, he starts asking about CAR-Ts, and then he talks about the ViaCyte partnership. So I'm just wondering if, potentially type 1 patients, this is what we talked about in the previous video in one of the pipeline where we were looking at the type 1 diabetes. Okay, and then let's see how he answers this question here. He's going here, and he's talking about, so he's talking about, the history behind how it's been done. And it basically just reiterating the history here. And then he says in 2012, everything basically just changed, where in the past it cost $1-2 million, which is actually in our previous video. Brett from ARK Invest, the director, he mentioned this fact as well. So the fact that the CEO mentions this in this interview is interesting, because he's recognizing that the alternative is extremely costly. And again, I think he's mentioned this also in previous interviews as well. So this isn't anything new, really, but it's just the fact that he's basically reiterating that fact, right? And this is something that I think as investors we should be doing when we are investing in a company, no matter how the company's stock price is, whether it's increasing or decreasing. You always got to remember, what are the alternatives, right? Why did we initially invest in this type of company, right? And if CRISPR Therapeutics, can't do it, or any other company in this field, then basically you're left with an alternative that costs way too much, that is not scalable. And I just don't see a world where, as we're improving technology, we're getting fancy gadgets, we're getting like electrical vehicles on the road, we're talking about robotaxi on Tesla, we're talking about all sorts of technologies, and I just don't see a world where diseases which can be cured, which have been cured. If you look at in the previous section of this interview, right, we talked about 10 of 10 patients were effectively cured. So, and this is not going to cost $1 million per patient to cure these patients, right? I just don't see a world where we have these diseases laying around. I think we saw that number, like hundreds and hundreds of thousands of people every year are born with either those two diseases, right? Beta thalassemia or sickle cell disease. I just don't see a world where we live in this, where we have fancy gadgets. We have, we're going to Mars, for example, right? We're going to space, and we just can't cure diseases when we actually have the tools to do it. I don't think that's going to happen. I just don't. The optimist side of me just doesn't believe it. So we're just going to go here. Okay, he's here saying it's in 10 years we're no longer going to have to wait this for kidney transplant and liver transplant. I think you're okay. Okay, sure. So he's basically giving some of his predictions. Okay. Yeah, so he's saying here, see, I mean, the question was about type 1 diabetes, right? So he's mentioning that you've seen all the news around insulin. What's the impact of the system as well? There's an unmet need, not just from the individual standpoint, but from a system standpoint, right? So okay, so hold on. Before I make my comments here, let's see here. What's interesting is about 20 years ago, around the dot-com boom era, was this thing was Edmund protocol, sure. Okay, and it said, okay, it's fine. It's a short supply. Yeah, so he's saying that, okay, so he's saying that, to find these types of cells, right, it's in short supply, it's extremely hard. I'm assuming it is also costly, so this is extremely hard to do it. All the supply you need to inject patients with these cells. And if you can use CRISPR to make them stealth, then you have a solution that can not just apply for type 1 diabetes, but also type 2 diabetes, right? So this is like, this is perhaps the most bullish statement he could make about this type of program in for that particular disease that they're trying to tackle, right? So type 1 diabetes, we saw that in a previous video in their pipeline. And basically saying that if we can do it for type 1 diabetes, right, technically, in theory, we could also cure type 2 diabetes. So this means that one day the whole insulin market disappears. I mean, this is just wow, right? This is, again, it's that type of question you have to ask. What is the value of curing someone with type 1 diabetes, type 2 diabetes, which obviously is the more severe and case that most people are aware about? What is the actual value? And I can't grasp my mind around it. I think it's way too hard to even assign a value to it. I mean, we know the alternatives are extremely expensive. We know this for a fact, and he even mentioned this previously for the other type of disease. But I think this is just amazing what they're doing, right? So I mean, I'm just repeating things I've said in the previous video. So we were fortunate to find a partner like ViaCyte, okay? And here he's talking about they've actually dosed 20 plus patients with the cells. They do, okay? So he's just basically, doubling down on his conviction with ViaCyte as a partnership to tackle type 1 diabetes. Sure. Okay, and let's just scroll down a little bit. Let's see if there's something else. Maybe not too technical. I don't think that was the purpose of what I wanted to do for this particular video. I mean, I'll link this interview in the description for anyone that really wants to read it. I really advise anyone that's really interested in this space to go through these types of transcripts just to get an idea of what the CEO is thinking, what we talked about in the previous video, where the leadership and the vision of the company is so important, right? And this interview, to me, it shows it, right? It shows that there is a vision out there, and the CEO is aware of the alternatives. And again, I just don't see a world where we live where these diseases are laying around and we do have the technology to tackle them, but we're just not doing it. I don't think that's going to happen. And I think CRISPR Therapeutics has sincerely, and other companies too, right? There's a viewer mentioned Fate in this space as well, that I know they're doing really good work. And there's other companies too, right? There's Antelia, there's Beam, there's Editas, many other companies. But just for the sake of what we're looking at, this is the interview with CRISPR. That's what CRISPR Therapeutics CEO. So that's why I'm mentioning this company here. Okay, so I'm not sure if we want to go how far we want to go with this interview, but I think it was like the first portion of the interview really that I was really more bullish on. And then I saw here here Philippe Drouet joins as commercial officer last month, and this we covered that in the previous video. But we are the leading commercialization of the US for that program. This we already know, we already talked about it. They're leading the whole ex vivo approach to curing curing the said disease that CTX001 addresses. So that's really good. Okay, and he keeps talking about commercial, and I think this was a big question in one of the previous interviews. I think it was even in the conference call too, right? And I think now the CEO, the fact that he keeps talking about commercialization, I think we're getting closer, right? I think you don't get to talk about that if your results are negative, or if they're not positive enough, or if you have bearish feelings about how the program is heading, right? The FDA approval and so on. So I think there's something to be said here in this, the fact that he keeps mentioning commercial, and the fact that they hired someone specifically for that role in the company, and someone that's quite credible in this space, right? So you see here, from a typical commercialization standpoint, also manufacturing supply chain sort of patient experience that's necessary to successfully sell a drug like CTX001. I think when this is what makes me think that once we get this approval, right, for CTX001, everything else is just like a domino, right? And the beautiful thing here is that it's not just for this company, but also for the other companies in this space, right? I think there will be many winners. I think I iterated that in the previous video. Many winners in this space, because there's so many diseases to tackle, and the processes are so different that you cannot just have one single company tackling everything. It's just not technically possible. So very bullish. Here he's talking about, this is something he said here. I think we've already gone from capacity of 10 of patients to now into 3 digits of capacity of patients per year, right? And then he's talking about, ultimately we want to go over 1,000 of capacity as we successfully launch and get. So they're looking to really increase the capacity, right, in terms of patients, which is really interesting. So again, just another type of vision that's mentioned, right? It's just straightforward, right? We're looking for 1,000 in the future. So that's really interesting. And now if I go and we look at here, has capacity. Yeah, so R&D headquarters in South Boston has capacity to hold up 1,200 people. And then he's talking about manufacturing facility where we can have multiple sites and support commercial manufacturing. So this is really interesting, right? So not just the fact he's talking about the commercial side of the business. Not only he iterated that they hired someone specifically for that role, but he's also sort of laying the groundwork, stating that there are sites that are basically ready to hold this type of movement in the near future. So this is really interesting. It's talking about the pandemic, that's fine. And now he's saying that we've had over 180 people coming in the labs over the last year every day. So they've been on the go even during this pandemic. So I think there's just really positive signals of this company, talking about maturity. And I think 2021, by the end of the year, I think things will really be a little bit lesser track for this company. So I just wanted to go over this interview with you guys. I hope you appreciate it. Like I said, I'll link the interview in the description. And I really appreciate you guys watching this video. Like I said, like and subscribe. It will help the channel. And I think my goal here is just to promote the awareness that gene editing is real. It is curing the disease that, for example, this company is trying to tackle in their program CTX001. And hopefully this helped you. Thank you very much. Have a good day.